Healthcare looks like a business, but it doesn't work like one. Hospitals don't sell a simple product. Patients don't set prices, and profit isn't the only goal. So why is healthcare so different? Let's break it down. Healthcare serves two customers simultaneously. In most industries, users pay for the products they consume. In healthcare, the patient needs care, safety, trust, and privacy. The payer, insurance companies or the government, decides what gets covered and how much gets paid. This split creates tension. Hospitals treat patients, but they survive financially based on payer rules. This complexity sets healthcare apart from typical businesses. Regulation deeply shapes healthcare operations. Healthcare is heavily regulated for good reasons. Take HIPAA, which protects patient data legally. Hospitals must invest in privacy systems, compliance teams, and secure IT infrastructure. These requirements increase costs and slow decision-making. Yet they exist to protect patients, not profits. Prices in healthcare aren't real market prices. Hospitals don't set prices like stores. Instead, payment depends on insurance contracts, medical coding, billing rules, prior authorizations, claim denials, and different fee schedules for different payers. Two patients can receive the same service, yet generate completely different payments. This complexity adds an administrative burden and inefficiency to the system. The stakes are much higher in healthcare than in other industries. In business, mistakes lead to refunds or lost customers. In healthcare, mistakes can result in patient harm, regulatory penalties, lawsuits, and a loss of trust. Because the stakes involve life and death, healthcare systems focus on documentation, safety, and compliance, even if it slows innovation. Healthcare spending in the US reached $4.9 trillion, about $14.7 per person. That's nearly 18% of GDP. At this scale, regulation and oversight increase significantly. Payment models also constantly change, causing big complexity among large systems. Value-based care tries to shift traditional healthcare by focusing on patient outcomes instead of sheer volume. It encourages better outcomes, care coordination, lower total costs, and population health management. The goal is to align finances with patient results, not just activities. This shift impacts hospitals greatly. Value-based care pushes them to focus on prevention and chronic care, reduce readmissions, and integrate various data sources. Hospitals must manage populations, not just individual visits. It's a massive culture and system change. Currently, we're making progress towards value-based care, but we're not fully there yet. Hundreds of Medicare ACOs now serve over 11 million patients. Much of healthcare still relies on fee-for-service payment, and adoption varies by market and payer. Healthcare systems operate in two worlds today. Healthcare isn't a normal business. It balances patient care, regulation, insurance rules, and financial sustainability. Value-based care strives to realign these forces, but systemic change takes time. Understanding healthcare means understanding the complex system behind it. Take the next step. Learn how you can support this vital change.